Chronic pancreatitis is a long-standing inflammation of the pancreas that alters its normal structure and functions. Unlike acute pancreatitis, which is a sudden inflammation that can resolve with treatment, chronic pancreatitis is a persistent condition that leads to permanent damage. This disease can develop in various forms, including obstructive and non-obstructive types. The obstructive type often results from blockages in the pancreatic ducts, such as gallstones or tumors, while the non-obstructive type is frequently associated with alcohol abuse or genetic factors. The causes of chronic pancreatitis are diverse. The most common cause is chronic alcohol consumption, which accounts for about 70% of cases. Other causes include genetic mutations, such as those seen in hereditary pancreatitis, autoimmune conditions, high levels of calcium or fats in the blood, and certain medications. Smoking is also a significant risk factor, increasing the likelihood of developing the disease. Individuals at risk for chronic pancreatitis include those with a history of heavy alcohol use, smokers, and people with a family history of the condition. Other risk factors include having cystic fibrosis, gallstones, or high triglyceride levels. Additionally, those with autoimmune disorders or who have undergone certain types of abdominal surgery are at an increased risk. Symptoms of chronic pancreatitis can vary but often include persistent abdominal pain, which can be severe and debilitating. Other symptoms include nausea, vomiting, weight loss and fatty stools, steatorrhea, which occur because the pancreas is not producing enough digestive enzymes. As the disease progresses, patients may develop diabetes due to the destruction of insulin-producing cells in the pancreas. Treatment options for chronic pancreatitis aim to manage pain, improve digestive function, and address any underlying causes. Pain management is a primary focus and can include medications, such as nonsteroidal anti-inflammatory drugs, NSAIDs, opioids, or nerve blocks. Enzyme replacement therapy helps to improve digestion and nutrient absorption. Lifestyle changes, such as cessation of alcohol consumption and smoking, are critical. Nutritional support, including a low-fat diet and vitamin supplements, is also important. Surgical management may be necessary in cases where there is severe pain or complications, such as pancreatic pseudocysts or obstructions. Surgical options include procedures to remove blockages, drain pseudocysts, or partially remove the pancreas. Endoscopic treatments can also be used to place stents in the pancreatic ducts or to remove stones. A nursing care plan for chronic pancreatitis involves comprehensive management of the patient's symptoms and overall well-being. Nurses play a crucial role in pain management, monitoring for complications, and providing education on lifestyle modifications. Nutritional support is vital, and nurses often work with dietitians to ensure the patient receives adequate nutrients. Monitoring blood glucose levels is essential due to the risk of diabetes. Emotional support and counseling may also be necessary, given the chronic nature of the disease and its impact on the patient's quality of life. Subscribe us for more videos like this and visit bazaarbiblio.com for notes and free PDF books. Thank you.